Pavitra, you're on mute.
Sorry about that. Good evening, everyone. Indian Institute of Management Kozhikode and its global alumni community celebrated its 25th Foundation Day on August 21st, 2020 by kicking off a year-long Silver Jubilee celebration. Join us in these celebrations by subscribing to the alumni social media handles and YouTube channel. Today, we have a webinar on demystifying mental health. Through this session, we hope to help our alumni community in understanding better what mental illness really means and the need for professional intervention to help us cope with mental health challenges. On the panel today, we have with us Dr. Rajesh Sagar, who is a professor at the Department of Psychiatry, All India Institute of Medical Sciences, New Delhi. He has an illustrious career of more than 25 years in the field of psychiatry and is one of the country's topmost researchers in psychology and mental health. Welcome, Dr. Rajesh Sagar. We also have with us Dr. Amrita Sen, a consultant clinical psychologist at Apollo Spectra Hospital, Bangalore. She is an MPhil in clinical psychology and has been a practitioner in this field for more than 12 years. Dr. Amrita is an expert in the area of depression and anxiety disorders and is an active researcher in the field. We also have with us two of our IIM Kozhikode alumni. First, we have Neeta Sarauge, my batchmate from PGP class of 2006. Neeta was a product manager at Axis Bank after completing at IMK. She is now the co-founder of a design and lifestyle firm in Goa called Curioso Sweets. She's co-founded this with two of her friends. Neeta sought help to cope with depression and is now a passionate advocate of psychotherapy, not just for mental well-being, but also for self-knowledge and growth. Our next panelist is P. Venkatarajesh of class of 2011. PVR, as he's known, joined Reliance Industries after MBA and is now a full-time photographer. He was recently diagnosed with ADHD, that's attention deficit hyperactivity disorder, plus anxiety. And he's been seeking professional help. This has made a huge difference to his life and is here to share his experience with us. We also have, moderating the session today, Ms. Nina Claire. She's a well-being crusader and mental health advocate. Nina has studied various subjects from psychology to journalism, art and design to business, and luxury product design. In her previous avatar, Nina was the editorial lead for well-being at Business World, where she created and launched the mental health vertical. Over to you, Nina.
Hi, just a correction there. I launched and created the entire well-being platform. So thank you so much for having me. I'm really excited. It's been a while since I've been on a panel. I was taking some time off and regrouping. And when one of your alumni, Preetam Roy, recommended me, said, Nina, would you like to be a part of this panel? I said, it's been a while, so why not? And mental health is a topic which is very, very close to my heart because I've suffered from mental health issues since the age of 19, and I've been managing them. And as a panelist, we're talking right now that because of that issue of having mental health problems, that is my superpower. So I hope that with this session, we're able to demystify what mental health issues are. And by sharing stories, we hope that there's an element of relatability for you. Two things, as you all know, have recently happened. And we're dealing with right now. One is the COVID crisis, and two is the recent suicide that's happened. So with both these situations, what has happened is that there's a lot of conversation on mental health, which is wonderful, for everybody, for people who are professionals in the space, people who are suffering from illnesses themselves. But what has also happened is that there's a lot cropped up, and through this conversation, we hope that a lot of it will get demystified. Also, what's been happening is everybody's sitting at home, everybody's working from home, leading their lives absolutely from home. So a lot of exchange of ideas have been happening, and but we cannot Can you hear me? Can you hear me?
Now we
Okay.
can.
So what I was saying is everybody who working from within us, because everybody there's anxiety, and two things that have happened are that the people who had mental health issues, they've been exacerbated, and the ones who didn't have, they also are tending to sort of get new issues. So these are going to be clarified through our conversations with the specialists, and I'm going to be starting with Dr. Sagar. Before we go ahead to that conversation, not anything a tool for diagnosis. So, Dr. Sagar, question for you. You know, people talk about physical health all the time, and they don't talk about mental health. So it seems to be a mystery. So I'd like you to explain what is mental health and why is it important to discuss it. You need to unmute yourself.
Yeah, good evening to everyone, and wonderful, Nina. And that's a very, very important question what you have posed. Let me just tell you, what we mean by health, and what WHO definition is, which is actually what it means is it is not just absence of disease, but physical, mental, and social well-being. So a lot of focus is there on the physical well-being, rather, mental health, and is often ignored. Now, if I would just describe what mental health actually, again, it is not just absence of mental illness, but it is basically, it comprises of four things. Which one who knows his own potential. Number two, who can deal with the stress of day-to-day life, who can deal with the stress. Number three is, who can work productively and fruitfully. And number four is who can contribute to the society and the nation. So you can see that this definition of mental health, it's not mine, it's a WHO definition, which actually includes so many things. It includes your work, it includes your stresses, it includes your contribution. But what in general, to simplify what it means is how you are happy with yourself, how you can relate to yourself, how is your interpersonal relationship. So these are the components of mental health, what we call also as a positive psychology, positive mental health, and so on. And let me tell you, mental health and mental illness are two different things. Mental illness is where we have the disorder of thinking, or perception, or behavior, overall personality, and so on. So that's a disorder type. Now, the important thing what we have to understand is, though we always say that mental illness are like any other medical illness, but there are certain differences are there. One, that mental illness, they suffer a lot because of high level of stigma and discrimination, and a lot of people do not want to talk about it. And it's a very unfortunate that we have to wait for incident like corona and covid, where mental health has come to the limelight, or the suicide which has happened. Actually, it is so important, because also we need to know that physical health, the physical problems and mental health problem, there is a strong overlap also, and there is a big issue of a violation of human rights. They're discriminated. So I think that is what, in general, one can talk about what mental health is. And it's slightly different, and it's a integral component of the health. That is what I want to emphasize here.
People don't understand the difference between a psychiatrist and a psychologist. So I'd like you to explain what is the role of a psychiatrist, and then we go over to Dr. Sen to understand from her.
That's a very good point. Actually, I will tell you, psychiatrist, again, it's basically a medical branch. It's a specialization of medical field where one deals with the behavior of a human behavior, or thinking or perception. That is what psychiatry is. It's a science, is a medical branch. And what a psychiatrist does is, when the person comes, we do the assessment, we do the evaluation, we do the examination, we do the examination with regard to physical examination and mental status examination and cognitive function. Based on that, we make a diagnosis of a person, and and these diagnoses are made based on the standard criteria. And let me tell you here, they are different from other medical illness where it is very objective, like blood pressure 120 by 80, whether you have tuberculosis or not. Where in psychiatry, the diagnoses are descriptive diagnoses, and they are made on WHO criteria of ICD. ICD means International Classification of Disease, and American system of DSM. That's how the diagnosis is made. Once the diagnosis is made, we treat them, and the management, it is a medication as well as the psychosocial management, where the therapy is there. So basically, if you see, the psychiatrist is from medical branch, where a person can rule out a medical illness also, because some of the psychiatric condition may also have a associated medical condition that has to be looked into more in detail, and also a psychiatrist who can give a medicine also. So that is how and make a diagnosis based on a standard diagnostic criteria. And of course, a psychologist, I think Dr. Amrita can talk about.
Thank you so much for clarifying all of that. So, Dr. Amrita, I wanted to ask you, first of all, thank you for joining us. And so could you explain what is the role of a psychologist? Because from what everybody has now understood is that a psychiatrist is medically inclined and can prescribe medication.
Yes. Good evening, everyone. So I will talk about that what psychologists are. Right. So role of psychology. Psychologists help the client to understand the root cause of their suffering. Why they are suffering, what are the things that are not working, and what are the reason behind them. They provide the safe environment. In that non-judgmental environment, the patient can express their views. Through clinical interview and all the assessment, like psychological assessment, also we do the diagnostic clarification of the case, and with proper management plan, we help the client to recover from the disorder. And again, help the client to develop a positive, healthy mind, develop the coping strategies, try to change the positive attitude towards life, and enhance their quality of life. So it's a global thing. Help the come out from the disorder part, and again help them to enhance their quality of life.
Okay, so right now, more than ever before, on social media, we see so many posts where people are talking about my door is open. Come talk to me. Come share with me. I'm available for you. I can lend you an ear. So why a psychologist and why not a family member or a friend or a stranger who's offering their ear to you?
So it's a very important question. I'm glad that you asked it. Actually, I want to ask all of you, if you have any serious medical condition, just like cancer or heart problem or brain injury or anything, will you prefer your neighbor or your friends or anyone to treat you? Or you will search for the best practitioner in the city? Right. So they are specialized to help you in that area. So why to take risk about your health? And again, it's mental health. They may not be able to tell you what to do, what not to do. Again, they may say that it's normal for to see all these things, because I have also gone through all these problem. Because sometimes people don't understand, because awareness is very less. Right. So it's better to take a specialized advice and help them to take the proper treatment and get out of that, because most of the mental disorder are curable and can be controlled. If you are not taking proper care, that can worse the situation, and even it can hamper your other areas of your life: emotional problem, behavioral problem, social problem, other thing. So better to take care from a specialized person.
Yeah, no, I totally agree with you. I feel that now, since so much conversation is happening, what your friends, families, and strangers who you interact with on social media, because now our entire life is on social media, is that they can offer you non-judgmental spaces. But the actual cure, I think, comes from and should come from specialists.
They don't
Dr.
need
Sen,
to. Oh, sorry. They don't need to give advice. Only they can listen.
Absolutely.
That also works.
So, I'm curious to know that you've been dealing with psychological issues for a long time and you've sort of been looking at people's illnesses and issues. So, what were the most common issues before, and what have you noticed a spike in because of the times that we're in right now?
So I see from my experience, I can tell that most of the cases I have seen for depression, anxiety disorder, for panic, OCD, obsessive compulsive disorder, parenting problem, marital issues, all these things. But now I am seeing that depression and anxiety spectrum disorder just increased a lot, significantly it increased because of this pandemic.
Listen, what I see right now around me is or what you're saying, but I'm seeing so many interpersonal issues where there was so much romance in the beginning for people. Now there's lack of space, and I was buffering right now because my daughter is doing something, my parents are doing something, and there's a lack of bandwidth. So there's interpersonal issues are just off the charts. Also, is that something you agree with?
Yes, yes. Nowadays, because other what happens generally, people spend most of their life outside their house, right? So they don't need to adjust with each other. See, there
Mm.
is a lot of difficulties now. They are struggling because everyone want to resolve the same thing right now. We want this, we want this. They don't have patience, but with time they will understand how it was initially difficult. I don't think now it is not that much. People able to understand the thing, what is the importance of staying together and be happy.
So, thank you so much for that. Dr. Sagar, I'd like you to highlight that when do you know that you need a mental health professional and their intervention? And what are the signs and symptoms one should be looking out for? You have to unmute yourself, please.
Yeah, I'm doing that. Yeah, I think that's a very important point, because what we have to understand here is that here we are dealing with behavior. Like, say, for example, like, a common example we give of anxiety or depression. So, say, for example, if I have to face an interview, obviously I will be anxious. If I have to, something bad has happened in the family, so obviously I will be depressed. Now, when we say depressed, does not mean a clinical depression. I think that's what we need to understand. So, what it means is that, some of those symptoms which are there, which are situational, which are, very mild, which are there for transient. So then they do not cause any much problem. But the thing is that what is important is, when the same symptom, when they are of moderate intensity, or or severe intensity, on top of it there is a dysfunction. Say, for example, because of sadness I am not going to office. Because of my sadness I am not meeting people, I am confined to the bed. Or my sleep has gone down completely, so my functioning is disturbed. So that is the sign, warning sign, that you need a help. That's one. Number two, if anxiety is there, which could be normal, as I gave some example, but when you have a tremendous distress within yourself, so distress and dysfunction are very important thing, and they becomes a important to seek a help, in that way. The other thing is that there are certain warning signs which one need to be aware of, either as a self or a family member. When a person who has a change in behavior, that is what we always say. If a person earlier was, fine, he was meeting people and, going around, but suddenly he has gone withdrawn for last few weeks or days, so then that is an important point that one is to be aware of. Second, when this, a person is just confined to himself, or person is, crying, or feeling sad, or there is a behavior, very abnormal behavior, getting angry for no reasons, or is not comfortable with self, or taking too much of alcohol, or so all these when are there, or even talking about self harm. So then these are some of the warning signs. Then of course, because family member are very important people, they too act as a buffer. But you need to interact with them. At the same time, family members should also be perceptive enough. With these changes are there, they need to talk about it. But the point will come, if the things are not improving, if things are taking a very serious proportion, then obviously then you'll have to seek a professional help. Now, professional help also I want to emphasize here is does not mean that you have to go to a psychiatrist straight away. You can talk to your family doctor also if a psychiatrist is not available in your place. So it doesn't mean that you have to because you have to only look for psychiatrists. Of course, if they are there, that's fine. But you can also meet your doctor or any mental health professional or psychologist. So that is a point when things are not working out, when things are getting severe, out of proportion, when these dysfunction is getting worse, then obviously then you need to seek a help, and you should not hesitate. Now the problem comes here only because sometimes these symptoms are there for years, and people do not take a help. That is why I just want to bring in here the concept. What we say is a treatment gap for psychiatric disorders almost to the tune of 80 to 90%. What it means that out of 100 people, only 10 to 20% people they seek a proper help. Rest they do not seek a help. Again, stigma and discrimination, all things are associated with that. People would rather like to go to a faith healer and other places instead of going to a doctor or any professional. So all those issues are there. But what we say always is identify early, then your outcome will be very good. You will become like a normal person. There are effective strategies are there which we can discuss. So that is what the point is. I think these are some of the important things where warning signs, as and when they are there, one should seek a help with a professional.
Okay, but I want to come up with one question to this. You're saying go to your family doctor. So what are your thoughts on a family doctor giving the first level of antidepressants? Because sometimes they say, start off with, say, Nexito or something. What are your thoughts on that?
Okay, so basically, again, I will tell you that world over, this is what WHO also recommends, that mild symptoms can be treated by family doctor, not only in India, anywhere in the world, even in UK or Western countries. That is the first contact, or general practitioner also. So they are the one who can identify the problem, assess the problem. And what I'm saying is medically, you have to rule out other conditions also, medical conditions also. One has to because what we need to know that 30% the overlap is even more than that. 30 to 40% person who have a diabetes may also have a depression and anxiety. Person who has a hypertension may also have 30%, may also have anxiety or depression, and so on. So that is why it's important that your first contact, who is there, a family doctor, one should not hesitate to interact with them. They may be the first responder at times, and and they can guide you, and there are certain by which principle they can refer you to the higher center or any professional. But first point of contact, if a family doctor is there, there is no harm in meeting them. Rather, it's recommended as per the WHO and international norms and guidelines.
Thank you so much. So I'm just going to reiterate, you said a few things that one should watch out for are disruption, distress, dysfunction, change in behavior, confined to yourself, angry, abusing alcohol, talking of self-harm. I mean, there are probably many more signs, but if you notice these, you should seek help. So Dr. Sen, over to you. How can therapy help? We've spoken about medication and going to the doctor, and how can therapy help is my question to you.
Actually, there is misconception that therapy means talking. So I first want to explain that therapy is not talking. Therapy is something, it helps the client to understand what are the cognitive and emotional processes going inside their brain. That means what the person is thinking and what the person is feeling, they are connected. I believe that if the circumstances are not responsible for the emotions, so if you can change the in between thought, that will help us to understand that how I can see the situation from a different perspective. I will say that therapy helps the person to when the negative thoughts are coming, the therapist helps them to challenge the thought with the proper way. Try to analyze the thought, try to find out the evidences why I am feeling this, why I am not, whatever the thoughts are coming that are not true, because thoughts will come and thoughts will go. Don't need to control the thoughts. Identify the negative thoughts, try to understand that, and develop a positive attitude towards that how I can fight with that thought. So therapy helps to recover from the disorder, and also from the positive part, it helps to develop the positive attitude towards healthy lifestyle, how you can feel competent enough. And again, it helps to develop your resilience power, because we cannot make sure that the problem will not come in your life, right? So if we can prepare ourselves with all the equipments and all the necessary planning and strategies, that will help us to fight the stress.
Thank you so much for that. Personally, I have found CBT to be very, very helpful. I mean, of
Yes.
late, that's something that's worked very well. In fact, using CBT and filling up those forms, looking at the cognitive distortion, those 17 distortions works really well, I find. So thank you so much for that. Sunita, over to you. You've had some wonderful experiences with therapy, and I love the power of storytelling, because not only does it help you, it also helps other people garner the strength to talk about their own. So please share your mental
Thanks,
health journey
Nina.
with us.
So about 4 or 5 years ago, I found myself in a place where, like Dr. Sagar mentioned as well, I found myself in a place where I was really feeling quite dysfunctional. I was finding it quite difficult to be motivated. I was just finding it difficult to cope with life and people and work. For the first time, I found myself really struggling to cope with work. I found myself, for no good reason at all, weeping on the way to work. And I couldn't even explain it to myself why that was happening. But it did feel like that wasn't the normal state of being, and it didn't feel like that's how I wanted to live my life. I also felt a certain level of numbness, I suppose, and it was just difficult to find motivation and joy in whatever I was doing. Fortunately for myself, for me, what happened was a lot of my friends are in therapy, and for work separately, I was doing a bunch of research on mental health. I was fundraising at that time for organizations that worked on mental health. So on the one hand, I had all of this data and knowledge about how prevalent mental health problems were. On the other hand, I had a set of friends who were able to access help both in terms of medication and talk therapy, and were seeing good results, or at least were feeling like they were making some sort of progress. So that's around the time I actually made a move from Bombay to Goa, and I started looking for a therapist. I was again fortunate enough to find a really good therapist who took a humanistic approach to therapy. I actually found the process of therapy very, very helpful, and the the beginning for me was really just beginning to develop emotional awareness. Despite the fact that I'm a reader and I am normally quite articulate, I found that one, I was not able to identify my feelings, and two, I was definitely not able to articulate my feelings. So the most I'd be able to say would be I'm sad, or I'm upset, or I'm angry. I really didn't have a bigger vocabulary to talk about what I was feeling. So it really began there, with being able to identify my own emotions, identify my patterns of behavior, my fears and motivations. And then once you start becoming more aware, it also starts becoming slightly clearer what the next steps need to be. And I think one of the things that a lot of people struggle with when they first start therapy is, hey, but my therapist isn't giving me solutions. And one of the things that you discover through the process of therapy is that the solutions need to come from you. What the therapist can actually help you with is to gain insight into what is causing the problems that you are facing currently. So that's where I actually found a lot of help with therapy. And very soon I found that my focus had actually shifted from using therapy to cope with depression to using it as a tool to get to know myself better and to start focusing on personal health, personal growth. So even now, I can't say that my depression has gone away entirely. There are depressive phases that come and go. But what therapy has done is it's made me a little bit more aware of what to do when that happens, how to recognize that a depressive phase is happening, and then very quickly start doing things that can help me during that phase to help get over that part. So that's.
So you were on medication for a while, you had mentioned yesterday. I'd like you to talk about that because people need to understand how that works also.
So I was put on. So when I started seeking help, I went to both a psychiatrist. I actually went to a psychiatrist before I started looking. Feeling like I literally couldn't cope.
We lost you for a bit. We lost you for like 3 seconds.
Okay. So I was saying when I started seeking help, I first went to a psychiatrist because I was feeling quite dysfunctional, and I was really finding it quite difficult to cope with life in general. So the psychiatrist did put me on an antidepressant, and typically they do advise that you take the antidepressant for at least 6 to 8 months before you decide to discontinue it, because it normally doesn't help in the short term. Personally, I did not enjoy the feeling of being on medication too much. It made my head feel a little bit foggy. It made me feel a little bit less present, and I did not enjoy it very much. So after about 6-8 months of taking medication, I stopped entirely. By that time, I'd also started talk therapy. So I felt confident enough that if there was a significant dip as the result of stopping medication, I would be able to identify and remediate it. So I did not really enjoy or found medication very, very helpful. But I know that quite a few of my friends are actually on medication and it really helps them. So I think each person has sort of an individual response to medication and therapy, I suppose.
Yeah, no, I love a few things that you spoke about, because you spoke about the fact that it helped you with your immediate issues, the distress you were under, and over time it evolved into a tool of personal growth, which is very lucky. I mean, you're really, really lucky if you get there, because it's almost like you're talking about a sort of evolution of self, I would say. Sort of the Maslow hierarchy, you're getting more higher up there. And I think getting the language, that's so wonderful, because today in schools, people talk about the importance of counseling. And it's so great because children learn more than just I'm happy and sad. You know, you hurt my feelings. So it gives you the vocabulary to express what you're feeling. And I think Dr. Sen had mentioned the word resilience, and that's something you spoke about yesterday. So it's taught you the power of resilience. But I would like to definitely mention over here that medication works for some people, in my experience, and it doesn't work for some people. You might not need it. And like Dr. Sagar yesterday had mentioned, that at 6 to 8 months is a good amount of time for you to have had the medication, because Neeta, you don't know that if you weren't under the influence of medication, where you would have been, you know? So that's a big question mark. So I'd like you to tell me, what were the tools of therapy that you gained?
Like I mentioned earlier, one of the... I'm sorry, yes. It's happening during the switch.
You're fine, you're back.
Some of the things that that I thought were very helpful. One was just developing emotional awareness and vocabulary, because I think we all develop maladjusted coping mechanisms as we're growing up and dealing with life, and we don't always know how to both identify and process our emotions, and it used to be one of those things that I used to get really irritated with my therapist, saying, you keep saying, hey, you have to process your emotions, you have to sit in your emotions, and I used to find it quite difficult, but I just feel miserable when I do that. But I think part of what I learned in the process of therapy is that when adverse events happen in our lives and we don't actually experience the full gamut of emotions related to those events, we actually end up putting these feelings away, and then later they catch up with us. So one of the first things I learned was just beginning to be aware of what I was feeling and being able to label those feelings, because then it allowed me to move to the next step, which was to try and understand why I was feeling the things that I was feeling. So the next step with therapy was actually trying to identify patterns of behavior. So therapy delves quite a bit into your childhood, what your parenting was like, what your interpersonal relationships have been like, and through that you understand what what's really going on, and what are your deeper fears and motivations, and what do you do about them. And over time you start then identifying things like, what do you value, what are you really looking for in life. So am I looking for creativity, am I looking for connection, am I looking for fulfillment, meaning, purpose. So it helps you to start identifying some of those things, and then start taking positive steps to actually achieve some of those things that you really value. And most of all, I think what it has also helped me do is develop a sense of self-reliance, to know that I can help myself at such times. So while I'm still in therapy, I know now that when I see a depressive phase coming, I know there are a few things that I can do. I can, for example, even simple things like exercising, mindfulness, meditation, actually really help me stay in the moment, and therefore deal better with whatever's happening. It also makes me more watchful of, we all have a negative, critical voice in our head. So it makes you a little bit more watchful, saying, hey, a bad phase is coming. You can watch out a little bit and see that your voice isn't that critical. Like make that voice a little bit softer. Remind yourself, what would you say if it was a friend or a close loved one that was experiencing those things. So it does equip you with a bunch of tools that you can then use in the future, in the present, and in the future to help yourself a little bit, while you continue to delve deeper into what your issues, what your problems might really be with your therapist. You can do things to help yourself as well. So I found that quite helpful too.
Okay, that's wonderful. But I want to ask you one last question, Neeta. So through your entire experience with your mental health journey, which continues even now, what have you found to be your superpower? Like I mentioned earlier, that for me, my anxiety makes me become anal to the point of I'm a perfectionist. So what is your superpower?
I don't know if I would call it a superpower, but one of the things that was quite hard to see in the beginning, but with time you get to see it. Earlier, I really did not see any any positives to having any kind of a mental health issue. Over time, with therapy, with reflection, one of the things that I have come to see now is that every time I have a depressive phase, I come out of it with insights about myself, with epiphanies about myself, with understanding myself a little bit more, and therefore, I don't know, being a more authentic version of myself. I feel closer to who I really am than I ever did. And I think whether or not I can call it a superpower, it's a really great feeling to know that you really are trying to be who you are, and you're getting an understanding of what you value, who do you really want to be.
I think that's so beautiful. It's really a lucky place to be at if you have epiphanies. And if you have a great therapist, you can have an epiphany on every session. So thank you so much for sharing, Neeta. And Dr. Sagar, I'd like to come back to you on the topic of medication. People view medication as a sign of weakness, and they're curious to know, okay, fine, if I give in and I have the medication, how long do I have to be on medication? What are some of the side effects? And will I need to have medication again? So if you could comment on that topic, please.
No, that's, I think, a very important point. And let me again tell you that, this is a very important issue that, about medication in different psychiatric disorders. And I will tell you the basis that why the medicines are given. I think that also because a lot of research which has been, being done more so in last 100 years or so. And what is being found that some of those psychiatric conditions are because of some of the brain chemical changes, and there is a good evidence all over the world where and we do correct them by giving the medicines, and of course, and these are well researched, and there is different methods of doing it. It goes through different phases of trial. then only we come to know that these are effective medicine and these are not effective medicine. So this is all evidence based, where we have a good evidence. And always I say, a lot of people ask me that, why I am given medicine. I always give the example, okay, diabetes, you take medicine and there is no, or hypertension, you take medicine, then what's the problem? Now, again, let me tell you, medicines again are decided, that whether this person will need medicine or not. A lot of myths are there about medication. And so it's not that everyone will get medicine. I think, let me clarify this here. It does not mean that a psychiatrist will only give medicine, because psychiatrists also decide whether this person will need medicine or not, number one. Then also it is decided for how long the medicines are given, and if and the best evidence of the treatment is when there is a combination of medicine as well as therapy session. There are psychiatrists who does the therapy sessions, they do the evaluation, and also they give a medicine. So, but later it is decided that, that how much the medicines to be given. What Neeta just said, that 6 months. 6 months is a time for depression. We do give a medicine, but again, it depends on the situation. But there are a lot of myths about that these medicines, they have a lot of side effects. Once taken, they are taken for lifelong, which I would say they are all myths about it. And all, I think, but let me tell you, sometimes medicines are life-saving also, because we all know that, depression can be a life-threatening. And if medicines are not given on time, then they can be very harmful. A person who is a violent condition like schizophrenia and different other mental disorders, which are bipolar disorder, then the medicines are so important, because then the therapy becomes a later part, but the medicines are mainstay of the treatment. So what is important is that we need to see that psychiatrists will decide whether which medicine to be given, for how long to be given, but one should not go with what the myths are there, which prevails around, that, a lot of negativity about that. But yes, I think what is important is what Neeta also just mentioned. It is important to communicate, have a dialogue with your psychiatrist, because also giving medicines, like even for depression, is like having different brands of a car. We have 25 different types of medicines available. So if one is not working, one can give another one, like that. So it's not only one kind of medicine. Also, let me tell you through this medium that we have all the medicine available which are there in anywhere in the world. Like we have medicine which are there in Europe, as well as the USA. India has, our country has all kinds of medicine available. So one need not, earlier we had to import it, but now, not now. They are all available. They are very effective, but all will depend. But the only message what I want to give here is that one should be in touch with your doctor, with your psychiatrist, when to reduce this medicine, and these medicines are not taken for lifelong. Let me again tell you, they should not be in your control. It should be in the control of a doctor who will prescribe. Sometimes one trying to self-medication, because these medicines are very effective. That also is important. But one should not think that if I take a medicine, then I'm a weak person. And these are the myths, because if it is helping you, always I say, it is like headache. Either you bear it, or you take treatment of these medicine. If you are able to bear it, it's fine. Then there is no problem. But why you want to have a poor quality of life? Why we want to suffer a pain if there is something available? The same thing we do not say for diabetes and hypertension. We always try to give a medicine. So with this medium, I just want to say that this medicine, again, it is decided, and what the minimum dose is. First, it is decided whether to give or not. It's not that everyone will get a medicine. If yes, then what doses? But one should be in regular touch with your doctor, with your psychiatrist, and what all symptoms you have, you should always report to the doctor. Because many times what happens, you go from one doctor to another doctor, then from second to third. So there is a doctor shopping. So one doctor doesn't know that what happened. So it's always important to be in touch with a doctor. And there are different kinds of medicine. One should not be so much obsessed about medicine. And also let me tell you at what Neeta also mentioned, because these 6 months of medicine were very important, and perhaps they would have played the role for therapy. And also through this medium, let me tell you, psychiatrists are very less in our country. Even lesser or rarity are the good psychotherapists also in our country. They are. So she was fortunate that she got a very good psychologist, but many places they are not available. Think about a remote place where you do not have even psychiatrist there. Leave aside a
Yeah.
psychologist. So family doctor will have to treat. It is not that for person will have to travel 500 kilometers to seek a help. It's not so. And also again, let me tell you that also it is important. The therapy session again they take time. Sometimes when I tell them, okay, why don't you go for therapy? They say, doctor, I don't have a time. 1 hour. How will I come from two? It takes about 2 hours to come to this place. Spend 1 hour, so my whole day, half a day is lost. So again, these are also concern about people because they are not very comfortable with having a therapy session. And also again, it depends. That is why whenever we decide about the management plan, we need to discuss with the person, we need to discuss with the family, then only we come that, okay, this is a plan for you, now you decide, like that. It's a participatory model where we discuss for the treatment as such, which is important.
No, that was wonderful for you to share so much. I keep on talking about this, and I myself keep slipping into the same thing. One feels there's a certain sense of weakness when you have medication, but you have to remind yourself that just the way if you have a crisis with your physical health, you have to get medical intervention. The same way you have a crisis with your mental health, you need to have intervention. So I think it's very important to remind oneself it's not a sign of weakness. And I'm very excited for Venkat to now share his story, because he was lucky to have been diagnosed later in life though, but he's found that sweet spot of medication also. So Venkat, please do share your story with us. And unmute yourself.
Yeah. So the thing is, for me, as long as I have known, I had issues with memory, and I between things I used to drift off. If someone is talking to me, I would listen for a while, and I would drift off. This has been there for a while, and because of this, I have a hard time remembering stuff. So what I saw over a time is I saw certain patterns in the way I was performing. Like I was a 10 pointer in my college, so it was a structured environment with a good support system. There was a short-term rewards, and there was also, when there were exams, there was a sense of urgency. This all worked really well. Then I did a job in a storage company as a developer. So when I got there, it was extremely unstructured. There was no system. Like, people are quite judgmental, so it was difficult to take help also. And I literally had to read code to understand what was happening. There was no documentation, and I was expected to perform, and so they paid quite well. But the thing is, I would get lost. So the thing that others were taking 5 hours, 6 hours was, to do certain tasks, I would take maybe 15 hours, 20 hours. Sometimes I would just get lost. I can't seek help, so I'm stuck in that loop. So eventually it got to a point where I was towards the end, I was asked to leave. But luckily at that time I got into an IIM, so I came to IIM. So, but I entered with a bit of low confidence. Again, I was able to do well at IIM because the same thing. It's a structured environment. There you have good peers. You have CGP as a short-term reward. There is always, you have so many case studies to do everything. So you just need to look at your day only. You don't need to think too far ahead and plan. So again, I did pretty decently there. Again, after that, I got into Reliance. Once I got Reliance, again, it was an unstructured environment. Luckily, MBA helped me to structurize well, so I did slightly better. But again, here I was taking more time. So I think first 6 months around, I struggled here, and around that time, I got a peer from another IIM. So what I did is I took a lot of his approach. He helped me get a structure to work, and I think in the second year onwards, I was performing much better. So post that, I got into photography. So from I got into photography, and around 3 years back, I got married. So see, during the photography time, I could be with myself. So there was no accountability, or there was no way to, even if something was wrong, I was okay with it. But once you got married, there is no structure in your life, and there are a lot of things that get added. So again, I see that I'm forgetting a lot of stuff, or I see that it is actually affecting my wife. It's also affecting me in various ways. So I get to shoots, I'm forgetting lenses in the hallway. Their staff comes and picks it and gives it. It's like a couple of lakhs. I'm doing something, and then I ended up putting a Bluetooth speaker in a fridge. I misplaced jewelry. I forgot where I kept it. I had a panic attack. I was driving a car. In the middle of it, I saw something and I drifted. for a few minutes, for a few seconds, and then I lost reaction time. I had an accident. So one other thing is I noticed this during one thing that always scared me was with cars. With cars, whenever I was driving, I would pass a certain station, then I would drift off. Usually it's something sports related like Roger Federer or something. And then again after 5 seconds, I noticed that I'm crossing the next station. And I can't account what happened in this time. I'm probably driving an autopilot. So something very similar happened on that day, and then I had an accident. So what happened is this kind of created a sense of urgency. So I was initially seeking a therapist for the first few months, but the moment I had this panic attack due to jewelry and accident, this was in February and March. So immediately I went to a doctor. So
This
because there, yeah, this was this Feb March. So I had like, and also like, yeah, and since people keep saying about money, a lot of things, the car accident costed me for around 45 grand. I had to pay for the damages. I had to deal with police. I had to pay for my own car. I had to do insurance paperwork. It took a, and it kind of mentally scared me for a couple of weeks. So like, because of, so there's a sense of urgency for me. See, I was seeing a therapist around the same time, but because of that, I wanted something that could help me quickly. So that's the reason I went to a doctor. So in Feb I went to a first doctor. So he was treating me for anxiety. So I told him everything. For me, because I was also parallelly reading a bit, or I was discussing with a friend from therapy, she said it could be anxiety or ADHD, but the doctor said okay, we'll go with anxiety. And he gave us certain medicines. They worked nicely till a certain dose. Beyond a certain dose, for me, like they worked nicely in the morning, and between 2 and 5 I would feel very zombie like and very anxious and panicky. And again 5 o'clock onward it didn't work well. And so, and around a month after I was on the dose, I had an accident. So then I realized that maybe this doctor is not working, or that because that accident scared me, I thought I would find a doctor whom I know. The first doctor, I literally found someone on Practo with good rating. So I was not fully able to trust him also, and he was making his own judgment calls a lot of times. I couldn't question him or cross question him. So then post that, I found I come from a family of doctors. So one of my sister's friend suggested someone and who was specializing in ADHD. So then I directly went to her, and yeah, she kind of I think we had a 1 hour session where she went through about my childhood, everything, and whatever I told just now, she joined all the dots, all the patterns, and all the separate many things were happening, like unstructured, you are drifting, and all things, everything combined together. I came to realize that it was ADHD. So, and then
that you got the second opinion.
Yeah. See, this person, because I think she was a specialist in this area and she was also from abroad, she was quite open. So I could ask her, why not this, why not this? So she took time and she explained everything. And the next part is coming to medicine. So for me, like the day I took medicine, it was like I was like a different person after the medicines. So for me, like it's very difficult to work without breaks for half an hour. That's how I am. Like post the medicines, like I worked for like 3 hours, 4 hours at a stretch, and with very little or minimal breaks. It's very difficult to do chores. It's very difficult to what do you call it? To not forget things. So I kind of do something, and then I get into something else, and I forget the first thing that I'm doing. So once I was on medicines, it was like I was having a very high level of awareness, and I could kind of, and there were no running thoughts. Like it was much more peaceful. It's like as if I came from a meditation session or something like that. Mm-hmm. So there was some side effects. I would feel a bit sleepy in the afternoon, but like it's COVID and there's not much work, so I would nap a bit. But otherwise, like for me, it's working very, very smoothly, very nicely. And like my productivity before and after is quite different. Like I can literally do double the work, because earlier there used to be so much of distraction that an 8-hour day was practically like a 4 or 5 hour day. Like I wouldn't do justice to the entire 8 hours. And now like I can do that. So
like we were talking earlier, that your superpower seems to be that you found out that you have ADHD and you can shoot straight 14 to 16 hours now, and that's your high, right?
Yeah. So one of the things is with ADSD, it depends on, you need to know how to interpret it. It also gives you certain positives. So when I say positives, for me, it's like in creative work, and when I'm in a flow, I work really well. I'm a flow based person, and there, like, my concentration, everything peaks. So creative work, I can like overperform. I can work 16 hours. I can pull off 100-hour weeks, no problem. So, but where I need help is, there are certain tasks or certain kind of tasks where I lose focus. So I need medication, or I need certain lifestyle changes, so that I'm more, I can be in a place where that part is manageable for me. So, I think, yeah, it's wrong when people say that it's kind of a illness or disability. Sometimes, or in certain cases, it's that you need to know that you have a different way of operating, and you need to get tuned to that. It will take some time for you to get tuned to that, but once you get tuned to that, you will see that you're just a different person. It's like everyone is Windows, I'm like Mac. So
Yeah.
yeah, not
No, I like
so,
the positives also, and I really appreciate the fact that you were so proactive in looking and questioning, because it's important to question who your doctor is and who your therapist is. Because there's a book that one of my the girls who went to psychology to JMC with me when I was studying psychology, she came up with this book that your doctor is not your god or something like that, and I was like, oh my god, that sounds really cheeky. But when I looked at it, I think it's really important that no matter which specialist you're dealing with, it's important to be able to question that specialist. And I think in India, we're taught ki bas suno baat chup chap. So it's wonderful that you garnered the strength to even question your specialist. So I have a bunch of questions more on my sheets, as you know, but we're running out of time. So I think we're going to jump straight to the Q&A. But the most important question, I think, Dr. Sagar, I want you to answer, because this came to us before the session itself, that you spoke about the signs and symptoms, right? But somebody has asked, is there a checklist that one can look at? Are there questionnaires that I can look at to be able to figure out that I have a mental health issue?
Yeah, that's a very good point. And let me tell you, there are checklists are available, and they are there online. You can get, not only that, even there are apps also. When there are, if you see the apps, I think thousands of apps are there on mental health which are available. I think so that's there. But again, I just want to warn here that psychiatric diagnoses are not made by the just ticking the checklist. You can overdiagnose. You can be in the panic. The gold standard is always interview. But you need to have an interview with your psychiatrist. Then the diagnosis is made, as I said, based on ICD or say DSM criteria, and that's the standard world over. That's a standard practice. But of course, to screen out, there are checklists available. Not only they are available in the net, there are apps available, so one can see. But one should not take too much into it, because finally you will have to make a diagnosis with the expert. That is what my say would be.
So my notes from yesterday tell me, you said very clearly that there's a difference between screening and a face-to-face diagnosis. So the screening can kind of happen through these apps, which is not professional, but it can loosely tell you if you need help. Correct me if I'm wrong. Is that fine? Yeah?
Yeah.
Okay. Wonderful. Okay, so I'm going to leave out the rest of my questions and hop right into this private chat box that Anchit has shared with us. So I think, Dr. Sen, you are going to be answering the question about alternative lifestyle changes that one can make. So somebody has posed a question that, do changing diets and food practices help manage the brain hormonal or chemical imbalances? And maybe you can add to that and talk about lifestyle changes, also talk about mindfulness or yoga very briefly, because we're running out of time. We have like 20 seconds, but we're going to extend this a little bit. So
yes. See, lifestyle changes are not the treatment. It helps the persons to stay healthy. But when you have mental disorder or any problem, illness, you need to take psychotherapy and medication, right? So other than that, lifestyle changes, we can make ourselves happy with, if you plan your day, like try to keep a schedule for whole day, that will help you that to be on a routine. So I know that it's very tempting to not to follow a schedule for a whole day, but it's, believe me, if you have a routine for the day, life becomes much easier. It goods for your mental health as well as physical health. Write down gratitude diary. It's very important. Gratitude has tremendous power over our emotion. So when you write down what went well throughout the day, it helps us to look at the positive side. It is very simple. Whatever made you happy, even talking to somebody, writing creative thing, reading book, anything, anything. Write down the blessings of your life, positive achievements, positive memories, anything you can write. Next thing, physical exercise. Yes, do at least 20 minutes physical exercise. It will help you to secrete the endomorphin, that is called happy hormone. So you can involve your family member, that will be wonderful. Do exercise together. Next is mindful meditation. What is mindful meditation? Mindful meditation is basically staying on the moment or enjoy the moment without being judgmental. Try to feel the moment with your five senses. It's wonderful, actually. When you do something mindfully, na, you'll be completely on the moment. It's little difficult, but with practice, you can achieve that skill. Next is music. Research have shown that music has tremendous positive effect on our brain. It activates the pleasure pathway of the brain and it increases the dopamine. So when you listen music as per your mood, it also enhances your feeling. Right. And other tips like stay connected with your family, eat healthy, talk with people whom you can trust, share your concern, how you are feeling. Get adequate sleep. That is also very important. Avoid alcohol, any recreational drugs, limit your media exposure. You can explore your forgotten hobbies and you can new hobbies also possible. So focus on the positive of the things, whatever. It's life will be not easy every time, but if you able to focus on the positive, that will help you to stay happy.
Yeah, no, for me personally, the two of these questions, right, that over here have been posed about do changing diets and food practices help manage the brain hormonal and chemical imbalances? I can vouch for it myself. When I eat clean, my entire body and being is different. So I'm not well right now because I've eaten a bunch of garbage for 2.5 months, contrary to what I keep saying. So I think you'll agree with that. And lifestyle makes a huge difference to your chemicals.
Yes,
And second,
actually, hmm,
and secondly, somebody's asked a question over here. When do yoga? I'm not understanding this question. When do yoga and meditation are not effective to cure mental illness? I'm not
see,
clear
it's
what the
not
question.
going to cure, but when you do practice all these things, it will help you to prevent. It's not completely, but it will help you to stay healthy, happy that way.
Okay, then somebody said, why is it not possible to diagnose mental illness just like the physical illness using blood tests, scans, or other tests? Dr. Sagar, I mean, I think when the chemical imbalance.
Yeah, 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 yeah. Yeah, no, I just want to just add the yoga and meditation again. They are add-ons. They. I think that's a very common thing. That is, it should not. Let's say if you have a depression or let's say psychosis or any major psychiatric illness, then yoga, meditation actually can do a harm to you. So and there are evidence for that. So that is why I'm saying that you should consult your proper doctor for this or a mental health professional to really decide what will work for you. And generally yoga and meditation, they are important. Like even I will add a physical activity or exercise also in this, or balanced diet also into this, where they will add to your existing treatment protocol. They are not the standalone treatment for any psychiatric illness, though they may help you for prevention or thing, but not for the taking care of the treatment of mental illness. Okay, and the next question what you asked was why it can't be diagnosed for Nina. Can you repeat that?
Yes, the question is, why is it not possible to diagnose mental illness just like physical illness using blood tests, scans, or other tests? So if you could highlight.
Okay. I think I will just explain, because again it's a different seminar altogether. I think you need a full more than 1 hour discussion on this. Psychiatric illness, in fact, I touched upon this. They are different from medical illness. Medical illness, there are a lot of objectivities there, and diagnosis is based on pathophysiological model. Like say, for example, tuberculosis, TB, where we have a bacilli, we have bacteria which is there, and you make a diagnosis based on that. Whereas in psychiatry, the diagnosis is made based on the symptom profile. We have the symptoms, and we symptoms are not enough. Then we see the severity of symptom, like it should be a 6 out of 9 criteria. Then we ask for dysfunction, distress. Then the diagnosis is made. So basically, there it was just a numerical, more of objectivity was there. Here it is more of a description. Based on that, the diagnoses are made. It is not in India; it's a standard world over practice. I'm not talking, that's how the diagnosis is made. So that is why, the scan and all will only tell you the brain functioning, in the sense that if you have any tumor or any infection or anything in the brain, that will tell you, and that is important. Also, sometimes we do ask for brain scan, which is not that common in those limited cases only. But by and large, the diagnosis is made based on the symptom. You have to check for it. Then the distress. That is, and these are the standard diagnostic criteria, and which is different from the other medical conditions. I hope it answers that.
Yes, yes. So question number 7 is something that what do you do when a patient does not accept that he or she may be suffering from a mental illness?
Yeah, that's a very good point, because it can happen, and that is why again I was talking about the difference between psychiatric illness and other medical illness. Here, the concept of lack of insight is there in psychiatric illness. That is why they are more challenging. Also, I will just explain a bit. Lack of insight means if I have an illness, psychiatric illness, there are some illnesses where I will not be aware that I have illness. I hope it explains. If a person has chest pain or abdomen pain, they know that they have the illness. They know, they will know that they have to go to hospital, they have to take a treatment. But there are some psychiatric illness where there is no insight. They are not aware of their illness. So that is why there is a problem. And so at that point, and that is why it's difficult also to make them accept the illness also. And and also here I would like to also mention, for other medical illness we do not have any law or legislation, but for psychiatric illness we have a legislation law also, which is known as Mental Health Care Act 2017.
Yes.
Because of the violation of right and so on. But for other medical illness, physical illness, we don't have any law. So that is what we need to see. That is why we can't force a person. Of course, there are involuntary admissions. Most of the admissions are voluntary, but there are components for involuntary admission. But there are certain criteria are there. If a person is dangerous to self or to others, if it's severe, then only you can take for care. But the point here is what I'm trying to make. Sometimes people, they do come. I say, okay, talk to the person, make them convince, make them understand, and if need be, the person will understand. Then you can take him to the hospital. In that way. So it's a dialogue which has to continue, and it can happen, especially in those conditions when there is a lack of insight.
Yeah, it's not like back in the day in the Hindi movie style where you could drag somebody and take them to get help. There's another question. I think I'm suffering from depression, but my family is not accepting it and are not supportive. What should I do?
If I can say that if you are adult or even, and you don't need help of any family member, you can straight away go to a doctor, and treat yourself. You don't require, endorsement of a family member. In fact, that's what happens many times. Let me tell you, many people who come to me, they said, my family was initially against this consultation, because we have to understand that, again, psychiatry is different because it has a lot of stigma attached to it, and we have to understand this point. And that is why people, and that is why we have such huge treatment gap also. People do not want to come for psychiatric help, because people will say, okay, if you're taking this help, what will happen? What will happen to your marriage? What will happen to our status, and so on? So there is a huge stigma, and that is why people and many family members do not accept it. But also there is a reverse also sometimes, family members are. But if you need help, try to convince your family member, tell them, okay, these are the things. But if you think that you have a distress severe enough, then you can straight away go to hospital. The family members may not be. If you think you are sufferer, then you should take care of yourself. And your family will not come. They will. Sometime what happens, these psychiatric illness are not seen as a real illness also. Like if one has a abdomen pain, if one has a fever, then they think, oh, this is a real illness. If one is saying, no, I am not feeling good, I am feeling sad, I am feeling anxious, I do not want to go for a walk, they think, the bahane maar raha hai, so he's just doing like that, so they are not thought of a real illness, and that is why sometimes family members, they do not accept it. But it is your job, you have to convince them. If not, then you can straight away take a help through any professional.
I think it's going to be decades before the stigma will go, but it's wonderful that there's so much conversation around destigmatizing mental health issues. Somebody's asked over here, to what extent can remote video consultation help in addressing mental health issues? For me, I mean, Dr. Sagar, I have found I'm not even doing video consults with my therapist at this point. I'm just talking to her on the phone once a week, and it's helping me with my anxiety and my whole personal growth. But I'm in the same space as Neeta is. I'm not using it to deal with any urgent situation. I've kind of dealt with the tools. But if somebody is new to this and is approaching mental health interventions, what is your experience right now, that how helpful is teleconsultation?
No, that's a very good point. I just want to, through this medium, educate many people. India, in our country, the government has issued a guideline which was there in last week of March, where the telemedicine guideline had been approved by the Ministry of Health. It is made by MCI, so it's legal now. Where you can, especially due to our COVID, this pandemic, that has become illegal. So and also let me tell you that many major institutes, like our institute AIMS, we do give a teleconsultation. That is that's our mainstay. We are helping people. They are sitting at home and we are given consultation. So I just want to give a message here that anyone who has a problem, if they are able to get a teleconsultation, that's a very good thing, because you will not be exposed to hospital, because many of the hospital have become COVID positive cases are there. So why you want to come out of, you take a transport, come to a hospital, you risk yourself. If your job is done through a teleconsultation, that is good enough. So I want to give a message here, so they can approach their hospital. Teleconsultations are available, helplines are available, they are available in Ministry of Health website, so you can take a teleconsultation, and they are very helpful. In fact, what I do, always I ask, it's easier to take a teleconsultation because you are not wearing a mask, I am not wearing a mask. In hospital, I have to wear a mask. I have to wear a mask. I have to wear sometimes PP also. So there is a barrier. And also I have reported somewhere that so these social distancing and these masks and PPE, sometimes they act as a barrier. For your communication. Your movement, facial movement, your eyes. So it's okay. I think if you can be helped. If your distress can be relieved by teleconsultation, then why not do it? And because you are seeing face to face. And of course, if there are some instances where you will require a physical, presence, that's a different situation altogether. But first, one can take a teleconsultation. Based on that, your doctor will tell you if you have to come physically, then that's a different thing altogether. But we need to encourage the teleconsultation method for psychiatry.
So actually, when this law, whatever was passed in March, I was on a panel with Dr. Demystifying, and we're talking about prescription. So now you can have a prescription online also. Yeah, and I was talking to a friend of mine in LA who's a psychiatrist, and he said, Ninna, I am doing, I have so many more cases, and I find it's so much more convenient to talk, on the computer, use telehealth consults, because when I'm wearing the PPE kit, I have the shield, I have the mask, and so does my client. And there are psychiatric cases. So he said, I can't see the milli movements of their face and the expressions that they have for me to be able to diagnose. So I think it's great. And another thing that I want to go back to now is, because people are asking again that how do I get my family on board? So I want to come back to Venkat, if he could please unmute yourself. That how did you bring your family on board?
So see, my brother and sister are doctors.
Mhm.
So with my dad, it was easy to explain, and I think my brother also explained. With my mom, she has a thyroid condition.
Mhm.
So what I used that. So thyroid basically is a gland. A gland is not producing the necessary chemicals. What I told her is that I have a similar condition in a part of my brain where certain chemicals needed to function optimally, they are not produced in a sufficient amount, so that leads to issues for me in terms of focusing and memory.
Mhm.
So as a result, I need to take medicines. So I think she got that example because it was personal to her. She was able to relate.
Mhm.
So in some cases, you might be able to use some such conditions in your family. Like a lot of people have diabetes, a lot of people have thyroid. It's very
Mhm.
common. So in some cases, you can use these examples. Maybe when people realize that it's helping them, they might think that this medicines help. And later they ask me after a month or so, is it helping you and all? And then I told them that how it has been like before and after. So now they are quite happy that I am on medication. So
Okay, so Anita, I'm going to ask you, did you deal with any kind of issues with your family, any stigma? And I want to also go back to the fact that you are working in a corporate setting. So was there a stigma attached? Were you comfortable sharing at the workplace that you were going through mental health issues? Because we're talking of some time back, it's not COVID times. So what did you go through?
So with
Workplace
my
and family.
with my family, actually, it was much easier. I think everyone worries about it, So because you don't understand what a mental illness is, and words like depression and anxiety are typically used quite almost pejoratively, and people think of it as something bad and something really terrible will happen to someone. And I think my family had the same kind of fears for me, but I think they're also quite open, and a conversation about what it means for me, what kind of help am I able to access, and what it does for me overall was a conversation that really helped. Actually, my separately, I think at least in my family, uh, there's been a lot of physical illness, and therefore there has been mental illness as well. So I think there was recognition of symptoms and what that feels like, and therefore there wasn't as much denial and resistance to the idea of mental illness in any case. Workplace was a little bit more difficult because clearly you need to start communicating about your dysfunction, because you are most probably, if it's an urgent or if you're actually really struggling, then chances are that you're actually struggling to cope with work as well. And it's a little bit, it makes you feel quite vulnerable to go and talk to your boss or your colleagues about the fact that part of your not being able to do what you're supposed to do comes from mental illness, and that while you're trying to deal with it, it's probably going to take some time. Um, so it was quite hard to do. It was difficult to do. Uh, but again, like I said, at the same time, I was doing research on mental health for the organization that I was working for. So there was again some amount of openness and some amount of awareness about it already. So that made it slightly easier. But it's not easy. It's not easy to talk to your employer about mental health problems. And I think part of the decision to be self-employed after that came from the knowledge that this probably uh, needs to change a little bit, and that I feel more in control of my time and how I deal with it.
No, that's wonderful. Thank you for sharing that. So there are two things that have come up over here. One is Yash Kumar. I want to help people in my team who wish to take sick leaves due to mental health issues whenever required. Is there any way I can be sure that employees don't misuse or take undue advantage of this? And the other question is, will companies discriminate if we disclose our illnesses? Um, Anchit, could you put that question back up there again, please? So one is, I think, Anita, I would like you to answer this question. You know, that is there any way that one can ensure that employees don't misuse this? What do you feel? How can one ensure that while being compassionate?
You know, My answer to this is, if you work in small closed teams where you actually know what's going on with each other, it's much easier. But that's a privilege that only some of us have had, not everyone. I think it's not easy to lie about mental health. It's difficult enough to reveal that you are experiencing problems to your colleagues and to your bosses. Uh, there is, I think there just has to be some amount of faith building that it's real, because I wouldn't say that one should require someone to submit some sort of evidence of mental illness. That seems quite extreme. So I think if you have open communication in your team, it probably is much easier.
Yeah, thanks. And also, I mean, I want to say to Yash, the fact is that if the person is performing well otherwise, I mean, while I was working at Business World, I mean, I had my moments, but I used to drive everybody crazy because I would generate so much content personally, and I would get, when I would do campaigns where they were used to 4 to 5 articles for a campaign, I would get 33, whether I was in Delhi or whether I was in New York. So I think they realized the fact that I was working hard enough. So I don't think there's any stringent way. And then people won't even be happy.
Yeah, I just want to add here that since the mental illness are stigmatizing, so people will not try to fake it. Obviously there are stakes involved in that. So by and large, we need to take that if person is saying that I am mentally ill, then when employer need to accept it, because in general no one will come and say that because it's so highly stigmatizing, will not come and say that. We need to see that as by and large, I am saying, and I think we need to accept it what they are saying.
Yeah, no, I think it's a whole different conversation. This question that I was going to ask, Dr. Sagar only earlier, that are you genuinely seeing a shift in the corporate culture? Because I'm noticing that there is a shift in the corporate culture, because you do so much research and you're part of so many panels. Have you noticed a genuine shift in the conversation around the corporate culture narrative?
Yeah, I think this is a change, let me tell you, has happened last few years. And I know that there are some corporate organization where they are concerned about physical health and mental health also, and more mental health. And they have categorized their employees by different ratings, red, blue, like that. One who requires a help, they help them and try to take care of them. And also there are some organizations where there are this they're walking, they are encouraged for physical activity also. It is there. So even some organizations, they encourage for socialization, picnics, and also I think that's basically what is happening. It is what corporate culture has they are able to understand now, that the mental health of the employee is so important, because it is linked with the efficiency, it is linked with their productivity, it is linked that how much absenteeism is there. And because it is being seen that because of mental illness, country like US has a loss of $1 trillion. So one have to understand that, because a lot of economics is involved in mental health. If your employee, your staff is mentally ill, then it will affect their overall functioning. So that is why now it is their interest now that they have to take care of the mental health of their employees also, because they know that it has a bearing on their final product and productivity. So that's very important point, and that is why one of the theme of we do have let me tell you through this medium, that we do celebrate World Mental Health Day. It is in October 10th, October every year. So one of the theme was mental health at the workplace. That was a theme a few years ago. So workplace and mental health is a very important issue.
Yeah, but I think, Dr. Sagar, it still continues, right? That will companies discriminate against us? I mean, I had the privilege, because I mean, to say, oh, I need a mental health day, I'm not feeling well. But then guess what? When I come back tomorrow, I'll be double of what I was day before yesterday.
I will tell you, I think you are absolutely right, because there are, different shades are there. When I say, it does not mean that, but there are some who are, some understanding has gone by. I think it's important to know that this, a lot of understanding has come by, in last few years, I would say. with regard to mental health as such. Stigma has gone down, but still it is too much, but again, there are many, because it's still viewed mental illness in a very negative way. The attitude is negative. So again, that is why more work is needed, I think, in this regard for in the future. That is what such type of interactions and education is so important.
Yeah, I think Dr. Sen has a comment over here. Would you please like to unmute yourself and share what you'd like to say?
Yeah. So a lot of researches reveals that the employees who are working from home compared to who works in office are showing more mental health issues and more stress level. See, stress is again one of the main reason for most of the psychological disorder. People are struggling with their restriction. They are concerned about family, concerned about health, self care, if about economic condition, right? They're bothered about uncertainty. Seeking information also, now it's like, I want to know how can I make sure that my family will be safe. All these things are bothering them, and negative apprehension that is going all around. So when you do little more socialize, then it feel little fresh, and if possible maintain whatever you can do at home, like cooking together, you can play some indoor games, even you can dance together. All these things, little things will help you to make yourself stress free.
Venkat, I'd like to come to you over here because, Dr. Sen just mentioned the word freelance over here. So I'd like you to hop in. I mean, the fact that you're a freelancer, but at some point, there's a conversation around, you're told to not share the fact that you have ADHD, right? People are told don't reveal at the workplace, or don't reveal for children, because now so many students are being told to go through those questionnaires that they're told when you're applying for colleges, don't reveal that you're ADHD. What would you say to those people? And because I'm sure there are parents online who are listening, who are aware of what ADHD is, but they don't want to share that their children have ADHD. What would you say?
So as I said earlier, so ADHD comes with its own set of strengths. So you need to pitch yourself from the base of strengths. Like for me, like as I said earlier, like creative work I can do in creative or flow based work, I can do for like 15 hours, 20 hours, I can pull off 100-hour weeks. So there are areas this works stronger. Anything where there is stress, for me, like I think I have seen a lot of people break down, they panic. For me, stress kind of adrenaline makes it better for me. I'm more focused when there is adrenaline. So any difficult client, anything things are very difficult, you send me, I kind of perform it in a much more cool way. So that, and I'm generally, I perform better when I'm talking and in person I'm better. There are certain difficulties in, say, tracking or tracking things or following up, but again, we have to build a system there to take care of it. For me, see, the way I would pitch is, I would pitch to my strengths, and I need to ensure that communicate in such a way that there are some issues that are manageable, or I have put systems in place that those are manageable. So at work, like I have a number two next, who is extremely detail oriented and who is good at tracking and taking care of clients. So he takes care of that. I know that this issue, if this person is there, he would do it much better. So yeah, so there's a person for me taking care of that. So somewhere So somewhere I have balanced that part. So
now I'm going to come back to your alumni, Preetam Roy, who introduced me. We worked together as such a great team because I had my strengths and he had his strengths. Jesus, he is so meticulous. He is so meticulous that I would create something, I would do my kacha pakka and say, these are my thoughts. And he would turn around and the presentation would be completely different. So we were lucky that we were a team together. So he balanced out where my anxiety came in, he kicked in, and the confidence helped. So wonderful that you're a freelancer and you have the luxury of appointing somebody who works well for you. But there are a few more questions over here. Dr. Sagar, I'd want you to answer, how do you identify who is the right doctor for you?
Who is the right doctor? Doctor means
psychiatrist.
To whom to see? Psychiatrist.
How do I know if I have a mental health issue? I feel I've hit these symptoms, right? How do I know that? And I've gone to a doctor. What should I be looking for when I'm talking to a psychiatrist or even first level to a counselor, to a therapist?
Okay, again, let me clarify here, because psychiatrists, what if nearby, if your family doctor is there, you can seek help. But if psychiatrist is there, you can go to psychiatrist. Psychiatrist again will assess you overall. Like they will take your medical history, other social history, your family history, and try to link up with your medical examination, physical examination, and based on that, they will formulate the diagnosis, come to diagnosis and management plan. And if let's say if it's more of a stress related and requires any therapy, then may refer to a psychologist, or or if it is a clear cut condition which requires a medical treatment, like a bipolar disorder, then will prescribe you medication. So by and large, my personal view would be, if you want to get overall checked up, your diagnosis, your your assessment with regard to medical health, and so you need to consult a psychiatrist. Based on that, a psychiatrist will refer to you, because psychiatrists, psychologists, or even social worker, they work in as a team, accordingly they will refer to you. But again, let me tell you here, there are many places. Only in recent time, number of psychiatrists have increased. We are much less number of psychiatrists in our country as compared to other Western countries. So don't wait for psychiatrist. If your family doctor is nearby, you can consult a doctor also, because some component, though very little, is there in their curriculum. So, but it should not happen. If you have an illness problem, you say that there is no psychiatrist, so I can't take a help. But if no one is there, then please visit any doctor who is there as a family doctor. You can talk to him also, or her.
Okay, thank you so much for that. Dr. Sen, I'd like to come to you. There's a question over here. Such wonderful questions. Is depression directly related to wanting or desire to lead a certain lifestyle?
See, first of all, I would say that I need to understand what I am expecting from life, and what the skills I have, and or what are the capacity, or what are the challenges I am facing. That is not a problem. So if there is a gap, what I am expecting and what my qualities, there will be frustration. But if I focus on that, I have obviously I have some positive things also. It's not only that I am not able to do this thing, that thing, other things. If we can focus on, there are few things that I am doing good, there are few things I am not able to complete, or I'm not able to follow that way. So need to understand the difference between my capacity and my expectation. So if we able to understand that part, so I think it will be more easy to cope with the situation.
I think there's an element of existentialism, I think, that this person probably is wondering, right? Because sometimes you're made to feel that depression is a bad thing. In my experience, people feel that you're indulging yourself is the point.
It's
and
not.
And I think that's a topic for a whole different conversation, talking about what is depression really, and the whole etiology. And we've actually gone way over our time, but it's been a wonderful conversation, and I appreciate being able to moderate this session. And will once again thank Preetham and Anchit for bringing me on board. And any other things any one of you panelists would like to share in closing comments? Something that comes to mind?
Okay, I can add.
Please.
So I would like to finish this with serenity prayer, that to remember everyday life, that higher power, give me the serenity to accept the things that I can change. Right? Courage to do the things that I can. And wisdom to know the difference between that.
Lovely. Thank you so much. So I'm going to, I think, is Pavitra going to join us? I'm just asking in the private chat, or do we wrap up right now? Okay, lovely. Thank you so much. We're going to wrap up. And 1 second, we wrap up. So just give me a second, please. Okay, wonderful. Instructions have been given. We are to close now. Thank you so much, and look forward to meeting you all offline again. Have a great evening. Good night.
Thank you.
Thank you.
Bye.
Thank you.
Bye.
Thank you to the whole panel and the.
Thank you. Bye-bye.
Thank you.